Okay, I see that it's 12:30. We've got a very large group on the webinar with us today, so let's go ahead and get started. But before we do, let me introduce myself. My name is Lloyd Morris. I am with AVS Medical. And for those of you that we have not had the opportunity to work with yet, let me mention that my partner Cindy and I started AVS almost 20 years ago. We are business partners with EMDs, formerly McKesson, the makers of the practice partner-based EHRs, which include Partner, Medisoft Clinical, Litech MD, and Practice Choice. We are also business partners with the MediTouch cloud-based EHR solution. In addition to Cindy, I've got quite a few members of the AVS team on the line with us as well today, including Kristen, Nick, Tim, Katie, and Aletha. They are all here with me in the office today. So let's jump in. Okay, before we get started, I do want to let you know that today's webinar is being recorded and that you'll receive... Okay, now, before we get started, I do want to mention that the webinar is being recorded, and within a day or two, you will receive a link to the recording along with a copy of the slides. And at the end of the webinar, there will be a resources page that will contain links to all of the reference information that I present today. And at the end, there will also be a question and answer session as well. Now, if your GoToWebinar control panel is blocking part of your screen, you can click this little red arrow right here on yours, and that will get it out of the way. At the end of the call, if you want to ask a question live, you can click the little hand icon right here, and I can unmute your phone line, or if you prefer, you can just type your question in this chat window, and I'll do my best to answer your questions at the end. One thing I want to mention about the phone, if your GoToWebinar control panel is blocking your view, you can minimize it with this little red arrow. You can click the hand so that I can unmute your phone line, or you can type a question down here and I'll answer it at the end. One thing about the phone line, if you are connected and listening to this through your computer, it's unlikely that you'll be able to ask a question through your computer, or it happens frequently that the microphone on a computer doesn't work, so I won't be able to hear you. So if that's the case, just go ahead and enter your question in to that chat window. This webinar today is EHR agnostic. It's not going to be about any one specific EHR. What I'm going to present is applicable to anybody's EHR. But since we do have a lot of our current users on, there are one or two areas that I do need to call out, and I will mention those as we go. Many of you on the line today are using one of the partner-based EHRs, and many of you are also using the MediTouch cloud-based EHR. Some of the things that I'm going to talk about won't necessarily apply to the MediTouch users, since the MIPS functionality in MediTouch is pretty much automated. So it's really just going to apply to apply to all EHRs, not just ours. As I mentioned, my goal today is to make the MIPS program and all of its components easier to understand. I'm going to present it, I hope, in a logical and straightforward manner, provide you with some clarity on what you need to be doing right now. But before I get into the details, I want to just go over what I think of as sort of a 30,000-foot view of MIPS, or sort of an overview. MIPS is a new Medicare program, so it's Medicare only. It does not apply to Medicaid. If you are a Medicaid provider, you will still fall under the original Meaningful Use program. What MIPS does is it takes I'll say the old, although it was only last year, the old Meaningful Use, the old PQRS, and the old value-based medicine programs, or value-based payment programs, and combine them into one new quality payment program called MIPS. In addition to replacing Meaningful Use, PQRS, and value-based medicine, it adds a whole new category that we haven't really dealt with before, called practice improvement. So that's a little bit of background. At the end of this year, at the end of 2017, you'll submit your data to CMS. The data that you submit will then be compared to certain benchmarks, and it will also be compared to the data that is submitted by all providers, regardless of specialty, across the country. From this comparison, each provider is going to receive their own MIPS score. Any payment adjustment that you'll receive in 2019 will be based on your MIPS score. So that's the quick overview, and that is going to explain some of the things that I'm going to talk about, but I am going to dig a little bit deeper into the details as we go. So, I think I missed a slide. Let me go back. Yes, I did. So there are two quality payment programs that are available under the Medicare Access and CHIP Reauthorization Act of 2015, better known as MACRA. As I mentioned, there are two. The first is the Merit-Based Incentive Payment System, or MIPS, and the second one is what's known as an Advanced Alternative Payment Model, or APM. In this first year, very, very few people are actually going to fall under an APM. So for that reason, today's call is focused solely on the MIPS program. So let's first talk about who is eligible under the MIPS program. So it's providers, MD, DO, DPM, DC, and even this year dentists. But they have expanded the eligibility status this year to include physician assistants, nurse practitioners, clinical nurse specialists, certified registered nurse anesthetists, and optometrists as well. Next year, they will expand that even further to include both therapists and speech and language pathologists. So it's a wider array of folks that are falling under this program. There are some people who are exempt from participating in MIPS. If this is your first year of Medicare, or if you are in an APM, you are exempt from MIPS. If you bill less than $30,000 or see fewer than 100 Medicare Part B patients per year, you can be excluded, or you are excluded. And by now, everyone should have received a MIPS status letter indicating your individual participation status for 2017. If you haven't received that letter, you can check online by entering your individual NPI number at this link right here. We're going to talk more about that website going forward, and you will get the slides so you don't have to write that down. Let's talk a minute about the timing. MIPS did start on January 2017. You can begin any time between then and the 2nd of October, and what's significant about the 2nd of October is that's the last 90-day period of the year. The data collection period for this year will end on December 31st, and then you'll need to submit your data to CMS no later than March 31st of 2018. Once all that is done, payment adjustments will start going into effect on January 1st of 2019. Last year, or actually at the beginning of this year, CMS opened up what's known as a public comment period about the MIPS and APM programs. Once that public comment period ended, CMS took that feedback and introduced something that they called Pick Your Pace. Pick Your Pace is essentially a set of options that lets each provider decide how much and or how deeply they want to participate in the MIPS program this year. So there are several different options available to a provider. The first option is you don't have to do anything. You can just ignore it, but if you do, you're automatically going to receive the full negative 4% payment adjustment. That's option one. The second option is what they call a test option. You can submit a minimum amount of data across several of the different categories for a very short period of time, and by doing so, you will avoid the negative payment adjustment, but you will also avoid any positive adjustment as well. The third option is a partial option where you can submit 90 days worth of data. And you can see there I took a quote off the CMS website that says you may earn a neutral or a positive payment adjustment and even may earn the maximum adjustment. Well, we think that if you do the 90 days, you're going to end up with probably a very small positive payment adjustment, around 1%. That's sort of what the common thinking is. The fourth option is that you can fully embrace the MIPS program and submit a full year's worth of data to earn the highest possible payment adjustment. Our guidance is that this is what this is what all providers should be doing. They should be submitting as much data as they can for the entire year's period at the end of this year. That way they will gain the highest possible percentage option. The other thing that CMS is going to do, and I don't have it on a slide, so I'll just mention it here, is that they will be taking every provider's MIPS score or quality score, and they will be publishing it in a publicly identifiable manner. So in other words, every Medicare provider's name and MIPS quality score is going to be published, not only on the CMS website, but they're going to make that data available free to the different health quality ranking websites out there, like Health Grades, and I forgot the name of the others, but I'm sure you're all familiar with them. So there are reputational aspects to this as well beyond just financial. Okay, now that we know a little bit about the background of MIPS, let's take a look at what's at stake. This year, the most likely maximum payment adjustment is going to be, or let me restate that. The most likely payment adjustment, either positive or neutral or negative, will be 4%, depending on an individual provider's score. And as you can see, that payment adjustment is going to increase over time, so every year it gets bigger and bigger. It is worth noting that this is a budget neutral program, meaning that CMS will be funding all of the positive payments to providers who achieve MIPS by paying a lot of other providers a lower amount of money. So it's almost a competition. So it's going to be budget neutral. They did, however, set aside an additional pool of $500 million for those what are known as exceptional performers. Those are ones with the very highest MIPS scores. And those exceptional performers can order a payment adjustment up to 3 times what you see there on the screen. So the exceptional performers can get up to as high as a 12% increase in 2019. Now, from everything I've read, they don't expect very many people to qualify for that, but it is out there. It is available. Okay, I've talked several times about the MIPS score, and I'm going to talk a lot about this going forward. But this year, CMS has introduced what they call a unified scoring system. It differs from how previous Medicare quality programs were evaluated. This table outlines the 4 different performance categories and describes the maximum points that each category contributes to your overall MIPS score for the 2017 performance year. And looking at this table, you can see that the quality program carries the heaviest weight, contributing up to 60% of a provider's score. The advancing care, which is the old meaningful use program, contributes up to 25% of your score. The practice improvement activity will contribute up to 15% of your score. And there's also a 4th category called resource use, or commonly referred to as cost. That replaces the value-based payment system from the past. It's worth 10 points, but in 2017 it counts for 0 towards your MIPS score. So we're not going to talk about the cost category today at all. And we're going to talk more about these as we go. Okay, so let's dive first into the quality category, since this is the one that carries the most weight towards your MIPS score. This year it represents 60%, and it can be actually go up as high as 85% of your MIPS score. And that additional 25% would come about if you were to take an exclusion in the advancing care category. And I'm going to talk more about this in a few minutes. And remember, advancing care is meaningful use. So there are circumstances where a provider could take an exclusion to advancing care, but if they take the exclusion to advancing care, meaning they don't have to do any of that meaningful use stuff, those 25 percentage points would be reassigned, is the term they use, reassigned to the quality category. And again, I'm going to talk more about that in just a few minutes. So in the quality section, the way that you meet this objective is that you have to select 6 quality measures from the 271 different measures that they have available. And one of those measures has to be what's known as an outcome measure or a high priority measure. More about that in just a few minutes. Additionally, they have set up what they call specialty measure sets. And when you read the guidelines, they say that an individual provider is encouraged to select quality measures that are applicable to their specialty. And I'll show you what I mean by that in just a minute. Our recommendation is that you do choose your 6 measures from a specialty measure set. And I'm going to share those in just a minute. Every measure that you report on has a possible score of anywhere from 3 to 10 total points. And the total points that you receive is based on several factors, including that measure's own benchmarks and actually how you've done on that measure in past years. So over the years, CMS has been looking at the quality data that each individual provider has submitted to them. And when you submit your quality data this year, they're going to look back and compare what you've submitted this year to what you've submitted last year or prior years for that same measure, if you did, and they will adjust your score based on that. Okay, so it gets complicated. The last thing I'll say about the scoring on quality is that how your quality data is submitted also affects the scoring, because there are several ways to submit quality data. I'm going to talk about data submission as well, but just know that if you are submitting your quality data from claims, it doesn't count as much as if you were submitting your quality data through a registry. More about that as we go. Okay, so this year they have also segmented the quality data into what they call efficiency categories: intermediate outcome, patient engagement and experience, and then structure. Right, so at the outset, or on the last slide, I said that one of your objectives, one of your quality measures, has to be an outcome measure. And if you can't find an outcome measure, you can substitute that with a high priority measure. Okay. One of the things that I want to say about the quality measures is that data completeness does affect your score. So a minimum 50% data completeness is required to achieve the maximum points for each measure. Remember, I said there's anywhere from 3 to 10. So if you want to get to 10, one of the things you have to do is submit at least what they call 50% minimum data. And what they mean by that is you have to submit data on at least 50% of that provider's or that practice's total patients who meet the measure, regardless of whether they are a Medicare or a non-Medicare patient. So in that data that you submit, it's got to include data on at least 50% of your patients, say, that fall under that quality measure. As an example, if they're a diabetic patient, if a patient has a diagnosis or a problem of diabetes, then at least half of those patients you have to submit quality data for that measure on that patient. That's as an example. If you submit data on less than 50% of your patients, you're only going to get the 3 points and not the 10. Okay, so you can see this does get a little confusing. As I mentioned, quality data can be submitted using claim data, but that may result in a lower score. And at the outset, I did mention that although this presentation was going to be EHR agnostic, this is the one slide I do need to mention for those of you that are practice partner users. And again, that is Partner, Medisoft Clinical, iTechMD, and Practice Choice. You must use the FigMD interface this year for your quality reporting. I've sent emails and blog posts out about that. I think a lot of you already know this, but for those of you that may not have heard about it, the old clinical quality measure tool that you used to use in prior years for quality or PQRS was not certified for MIPS. So instead, what EMDs did was they went to a third party called FigMD, who does have a certified reporting tool or an interface, and they will extract your quality data and they'll actually submit your quality data to a registry for you. But you must use, so if you're using Partner, Clinical, MD, or Choice, you must use the FigMD interface this year unless you're submitting through claims data. MediTouch users, you don't need to worry about that. As you know, you've got your patient dashboards and your provider dashboards, and all that data is going to come right out of those dashboards. Okay, I've talked a lot about quality. There is a fantastic resource available to everybody from CMS. That's qpp.cms.gov. And I'm going to actually jump out of the slideshow here for a minute, and we're going to go over into that website. So let me make my screen a little bit larger here so you can see it. This is that website, and this is the quality page. Let me scroll up a little bit. So again, in order to meet MIPS this year, you need to select 6 measures from the list of 271. In this blue bar right here, you can filter out the measures by whether it's a high priority measure, by the data submission type. So it might be claims, or it might be, if you're MediTouch, it would be EHR or registry. If you're Partner, it would be registry, right? So those are your options. The CMS web interface, by the way, that is only for groups of 25 or more providers. So unless your practice has 25 or more, you're not going to use the web interface. And this is also a good time to mention that CMS has been sending out emails lately stating that in order to submit quality data, you've got to register by I believe it's the end of June. And we get a lot of calls about that, but that is only for the CMS web interface. So again, if you don't have 25 or more providers, you can ignore that. There is no registration for people who don't have that many. But here is that specialty measure set section. So if I click that drop down, you can see that there are many specialties in here, and you can come in, choose your specialty, let's say neurology in this case, and then what happens is it filters out all the other ones and just shows you that there are 26 measures in here. And you can look through these and decide which ones are most meaningful to you. And as you click these, it will tell you the type of submission method, so it's EHR. It'll also tell you the things that you need to do, or that you may need to customize your EHR in order to capture the data to submit for this measure. So that's where you will look at and see the different measures that are available to you. Okay, I'm going to jump back into the slideshow, and let's make it go full screen here. All right. So that is pretty much all I'm going to say about the quality measures. I'm going to now jump over to the advancing care information. And again, this is the old meaningful use program. Okay. This accounts for 25% of a provider's MIPS score this year. And in order to meet the advancing care objective, a provider must use a certified electronic health record, abbreviated CERT, meaning Certified Electronic Health Record Technology, that has been certified to either the 2014 or the 2015 criteria. Depending on which certification your EHR has, the measures that you can select vary a little bit, very slightly, but they do vary. And I'll show you the list of those in just a moment here. Okay, but before I get into the actual measures themselves, let's talk a little bit about how the scoring for advancing care is calculated. This one as well gets a little confusing, but I'm going to explain it as I go, and hopefully it's going to make more sense as I get into some of these other slides. Basically, it's very similar to how meaningful use was scored in the past, but you'll get a base score for reporting a value of at least 1 in the numerator. So if you recall, as an example last year, I think, let me just use as an example, e-prescribing, I think was 50% last year. So if your denominator was 500, you had to have at least 250 in the numerator. This year, at a minimum, you've got to have one. You just have to have one in there. However, the more you report, the higher your score is going to be, and that's what the performance score means. Again, I'm going to delve into these, so if you're confused, hang in there. I'm going to go into it and show you an example in just a minute. In addition to the base and performance score, there's also a bonus score for including some measures from another category, and I'll talk about those in a minute. So your advancing care or ACI score is composed of 3 individual scores. The base is worth 50. There is a performance score that's worth up to an additional 90%. And then lastly, there is a bonus score of 15%. Once your overall score has been calculated, I have to laugh a little bit because I think they, as they laid this out, they must have said, how can we make this even more confusing? So here we go. Once your overall score has been calculated, your score is then multiplied by an ACI category weighting factor of 25% in order to determine how many points are contributed to your final MIPS score. I know that's confusing. Let's break it down. So let's say that a provider meets the minimum for one of the objectives. They get 1 in the numerator, 1 out of whatever. It doesn't make a difference. As long as they're 1, they'll earn that base score of 50%. And more in a minute about how we calculate the base. But then let's say they, instead of submitting 1, they submitted enough that they earn a 40% additional performance bonus. And then let's say they didn't do anything for the bonus category, so they got 0%. So we add the base and the performance, so we get 90%. But then we have to multiply that times the 25%, which is the weighting factor, and we end up with 22.5 points will go to that provider's overall ACI, or excuse me, 22.5 points will go to their MIPS score from ACI. So confusing, I know, but I'm still going to give you a few more examples here as we go. So one thing I will say though about that base score is that you do have, if you don't meet the base score, in other words, if you don't have at least 1 in the numerator or answer yes, you will get 0 for the entire ACI category. Okay. Okay, so I am, let's make sure I'm on the right page here. Okay, let me make sure I didn't skip a slide. No, I didn't. Okay, so earlier I talked about the level of certification or the year of certification of your EHR. So if you let me state it this way. Right now, as we speak today, both the practice partner EHRs and the MediTouch EHR are certified to the 2014 criteria. Here in the coming weeks, they will both be certified to 2015, but as we speak today, they're only 2014. So if you have one of those EHRs, you would have to use the set of criteria on the right, the advancing care information transition. So certified to 20, oops, that time I did go back. You'd have to use the certification criteria on the right. So there are 4 measures for you in the ACI category. That's the security risk analysis. That's just yes or no. E-prescribing, providing patient access. That's the portal. And then health information exchange. Those are the things that you would have to report on. Right? And then there in red at the bottom it says, again, it just states what I said a moment ago. If you don't answer yes or test a yes and have at least 1 in the numerator, you will get 0 points for the entire advancing care category. I'm not going to get too much into the minutia of the performance score. What this slide shows you that the more data you submit, the higher your performance score. So as an example, if a provider were to submit an 85 in the numerator out of 100 for the patient-specific education measure, then they would get a performance bonus of 85%. So if we look at that on the right-hand side, or excuse me, their performance rate would be 85%, meaning they'd fall here, and they would get an additional 9 out of 10 points, or they would get 9 out of 10 points for that particular measure. So I don't know if I've said it already or if I even have it on a slide, but our guidance on MIPS is that if your head is swimming from all of these categories and how the scoring, the bottom line is the more information that you submit, the higher your score is going to be. And one of my slides at the outset said our guidance was to submit data for the entire year and to submit as much data as you can. And that's why we say that, right? Instead of trying to figure out where you're going to be, just submit as much as you can and you'll end up with the highest possible score. The last thing I'll say about the scoring for the advancing care is there is that bonus available to you, and the way that you earn that bonus is that you send data to a public health agency or to a clinical data registry beyond the immunization. And like syndromic surveillance, not all states take syndromic surveillance, or to a cancer registry. Not all EHRs are able to do that. Some can, some can't. But if you can, then you're going to get an additional 5%. And then here's the one that's even a little more out there, is if you answer yes to at least one of the improvement activities. We haven't talked about improvement activities yet. That's the third category. We're going to get to that next. But if one of the improvement activity categories you choose involves your EHR, and not all of them do, but if one of them do, you'll get an additional 10% bonus. And speaking of advancing care, let's jump over to the advancing care category. This is the third and final category. Oh, excuse me. I'm very sorry. I didn't mean not practice improvement. Advancing care is still meaningful use. I do have a couple more things to say about that. As I said at the outset, or a few slides ago, this can be reweighted to 0% if the area that you practice in has insufficient internet connectivity. There are extreme and uncontrollable circumstances. I frankly don't know what that means. Or if there is lack of control over the availability of an electronic health record. And they are very specific when they say that not having one is not a valid reason. But you can ask that just this category be reweighted. If you want to make a submission to have the advancing care reweighted, you have to submit an application. I don't think those applications are available yet, but they will be at some point in time. And then if you do get this category reweighted, then the 25% from advancing care gets transferred over to the quality category. There are a couple scenarios where the advancing care will automatically be reweighted. So if you are a hospital-based MIPS clinician, but more importantly, if you are a PA, NP, CNS, or CRNA, the advancing care category is automatically reweighted for you. You can, however, opt that it not be. So if you're an NP and you want to submit data on advancing care, you can, but you get an automatic reweighting if you wish it to be. Okay, so now I'm back to the third and final category for this year, which is the clinical practice improvement. This is responsible for 15% of your score in 2017. And this is the one that, because it's a new one, because no one has ever really done this before, it's the one that's maybe the most mysterious. But you're going to choose improvement activities that are most meaningful to your practice from a list of 90 available improvement activities. And those improvement activities are segmented into the subcategories that you see listed here. You do not have to choose any particular category, or you just have to attest yes that you've done these things. There are no minimums for any of them. You do have to do it for a 90-day period, in order to, 90-day continuous period, to get the full credit for the year for the practice improvement category. Okay. So let's get into how that is scored. So the way that you get the 15% is by accumulating 40 points in this category. Improvement activities are ranked as either what's known as a high-weighted category or a medium-weighted category. High-weighted categories are worth 20 points. Medium-weighted categories are worth 10 points. So to get the maximum score for the practice improvement category, you need to get to 40 points, and it's up to you how you get to those 40 points. You can either do 2 high-weighted activities, or you can do 4 medium-weighted activities. 4 times 10 would be 40. So you can choose any combination that gets you to 40. They don't care. However, if your group has less than 15 providers, the point totals count twice, or they're doubled. So, as an example, if your practice has 15 or fewer, not 15 or fewer, less than 15 providers, those categories are worth, or those point totals are worth twice as much, meaning you only have to do 1 high-weighted activity or 2 medium-weighted activities. Now, by the way, if you are currently in a patient-centered medical home, you automatically get full credit for the practice improvement category. You don't have to worry about this one. Okay, so those are the different categories that make up MIPS this year. So again, it's quality, advancing care, and improvement. Reporting options. One nice feature under MIPS new this year is that if you are in a practice that has 2 or more providers, so that could be an MD and an NP, you can report as a group. So under MIPS, a group is identified as a single tax identification number with 2 or more eligible clinicians as identified by their NPI numbers and who have reassigned their their Medicare billing rights to the TIN. Okay, so the benefit of reporting as a group is that you only submit one set of data for the entire group, and then each member of the group will receive the same payment adjustment based on the group's performance. So that can work very well for you. And then lastly, I think I mentioned on an earlier slide, there is no registration involved with MIPS. There's just data submission and attestation at the end of the year. So that's a lot of information to throw at you on MIPS. You're going to get this slide, but there is a link to that quality payment program website. If this weekend you're having trouble sleeping and you want to really dig into how that scoring is calculated, there's a link there to, it's about a 100-page document the last time I looked at it, that really gets into explaining how the scoring is taken or is calculated. I would also encourage you to sign up at one of the AVS medical blogs. We have 2. The first one is for the partner-based users. The second one is for the MediTouch cloud-based EHR users. If you have questions and or just need more information, please feel free to reach out to me directly or anybody here at the AVS team. And the last thing I'll say, kind of a shameless sales plug here, is that we are offering MIPS consulting services this year. And there are a lot of people on the call today that do not have an EHR or may have an EHR that is not going to be MIPS ready. And if so, we have the MediTouch cloud-based EHR as well as the partner-based server-based EHRs, and we'd be happy to chat with you about one of those. So with all of that said, I am going to go ahead and open up, take any questions that you may have. And once again, if you're actually dialed in on a telephone or have a microphone hooked up to your computer, or your computer has a microphone, you can click the hand and I can unmute your phone line. Or if you prefer just to type a question in there, I will answer that question here as we go. So that said, I'm just going to say thank you. If you're dropping off, I will say thank you for your time. We know you're busy and very much appreciated that you've spent some time. So here's a good one. No more clinical summaries. So um, those of you that have been meaningful use over the last several years, you know that giving patients a printed clinical summary was something that you had to do and became um, kind of challenging. But so the answer to that is no. There are no more printed clinical summaries required. The next question is when will the slides be available? They should definitely be available tomorrow. I just like to go through honestly, what I do is I just go through the recording and I clean up all my mistakes and all my little pauses and all that to make it sound like I know what I'm talking about. So once I do that, I'll get that link out to everybody. You'll get an email if you've signed up for the webinar. If you're also signed up on our blogs, you'll get an email from that there because that's where it's going to be posted. Next question is, um, can we explain more about the MIPS status letter? Yes. So in early April of this year, CMS undertook a task of literally mailing letters to all Medicare providers, informing them of their MIPS status. And I've never seen the letters, but they basically just say, yes, you are responsible for meeting MIPS this year, and no, you are not responsible for meeting MIPS this year. If you did not get one of those letters, I'll show it to you on the screen right here, back at that same website. Let's go to the main page. At the top here, there's a big link that says check your participation status, and you can enter your NPI number right here, and it will pop up and tell you yes or no. By the way, it is the individual NPI, not the group that you would put in there. So I hope that answers your question. The next question. Oh, okay. Next, I'm sorry, couldn't see the rest of it. This question is Medisoft Clinical Program certified? Yes, it is. Practice Partner, Litech MD, Medisoft Clinical, Practice Choice are all certified. Right now, they are certified to the 2014 cert. That's not a bad thing. That's not a problem. It just affects which set of advancing care information you'll report. And it will be, by the way, they all will be certified to 2015 by the end of the year. So either way, you're covered there. The next question says that I mentioned that some users will need to use the FigMD interface. Who are those users? So if you are using Practice Partner, Medisoft Clinical, Litech MD, or Practice Choice, you must use the FigMD interface this year for your quality data. So if you're not already familiar with what FigMD is, it's a third-party company. You may, or let me say that McKesson, now EMDs, years ago when they designed those programs, those products, they did not design them with MIPS in mind. They designed them with meaningful use in mind. And as the program changed, as meaningful use evolved into MIPS, they were faced with the challenge of, well, do we re-engineer our software and charge a lot more money to our users, or do we come up with a better solution? The FigMD is very inexpensive. I think it's like $100, but what it does is it will extract your data. So you still are faced with a challenge of getting your templates set up, making sure that you're recording the data and entering the data in a fashion that it's there to be extracted. But once it's there to be extracted, Fig will pull it out for you. And then Fig is also, turns out, they manage, I think, 18 of the largest registries in the country. So they will also submit your data through one of those registries. Depending on which registry you go to, and they're specialty specific, there may or may not be a small charge for that. That's up to the registry. Next question, I think I just answered, but yes, if you are using Medisoft Clinical, you must use FigMD. And we can, although we don't really have anything to do with FigMD, we'll put you in touch with them. We'll help you make that connection and help you get that set up there. I'm going to plead ignorance on the next question, which is that Meaningful Use 3 requires that the EHR must allow patient communication using APIs. I apologize, I don't know the answer to that question, but I've got your email. I will find out the answer to that and I will send it to you. If your EHR is not, next question is what happens if your EHR is not certified to 2015 by the end of the year? Nothing bad happens. If you recall that one slide, and I'll put it back up on the screen so you can see it because I know, threw a lot of this stuff at you. Which one is it? If it's not certified to 2015, you will submit the 2014 data set to CMS. So looking at this slide, if you're still looking at the slides, on the right-hand side, under the 2017 Advancing Care Information, those are the four things that you would do for the ACI category. And if you look at the left side, if your EHR or when your EHR gets certified to 2015, those would be the things that you do. And they're very similar to one another. The next question, can data be extracted from the point-click care EMR system? I apologize, I don't know the answer to that. Again, that's an EHR that I'm not familiar with. I will get an answer and I will email you that individually. My guess is that via FIG they can do that, but I'm not sure. The next question is that if you don't have an EHR, is there a way to submit your MIPS data? Yes and no. Yes, remember quality data can be submitted via claims, and although I didn't get into the practice improvement activities, a lot of those don't actually require an EHR, but the advancing care, and that's the one that's on the screen in front of you now, that does require a cert, a certified electronic health record technology. So that's the no part. So if you're going to succeed under MIPS, you have to have an EHR. Here's a really good question. If you are one of the practice partner-based users, how do you check your progress today without the FIG interface? Well, first off, if you plan on meeting MIPS, and I'm assuming everybody does, then you might as well go ahead and get signed up for MIPS as soon as possible. Excuse me, you might as well go ahead and get signed up for FIG as soon as possible because you're going to have it. One of the other things that FIG does is instead of running reports, as you've done in the past, they extract the data automatically, and you're given a website to where, secure website that you can go to, and you can see right on that website how you're doing. In the meantime, you can run the clinical quality information reports that will give you information on the measures that they had up until this point. I think there were like 64 measures in there. So you can look at them, but you couldn't use that report to submit the data. Okay, so hope that answers your question. Yeah, the next question, part two from the same gentleman is what are practice improvement activities? Yep, some of them are totally opaque and non-specific, but this same website, if you go here under the MIPS and you go to the improvement activities, if you look through here, a lot of them are real straightforward, right? Some of you are doing chronic care management. That's one of them. Others have to do with patient surveys. I mean, if you'll just look through here, or if you're working with us and we're providing you these consulting services, we'll go through with you and decide which ones are going to be the easiest and most meaningful to you. Otherwise, just go through the list here and read each one and sort of figure out which one makes the most sense for you. I'll answer part of the next question. And this question is that I mentioned that we are offering consulting services and what's included with that. So our consulting services are going to be, several things we're going to do. We're going to provide the guidance and the knowledge about all of these programs and all of these measures. We're going to work with you to help you select the measures that are applicable to your practice and to your specialty. And for the person asking this question is from a cardiology practice, and there are a very specific set of cardiology measures. We'll help you go through those measures. More importantly, and I think really where the value is going to be, is we're going to make sure that your templates and the EHR is set up to correctly capture the data that you need to submit. We'll also work with you on the practice improvement activities and the advancing care activities to make sure that you are maxing out your score on those activities, and then look at your workflow to make sure that your workflow is supporting those goals. Um, I'll send you a separate email with the part 2 of that question, which has to do with the cost. I hope that answered that. This is a good question. Yeah, what happens if your EHR is not certified for 2015 by next year? Well, I've said a couple times that it's okay if your EHR is not certified to 2015 this year, but this is a very good question. And if it's not certified by next year, then you've got a problem. Your EHR does need to be certified to 2015 for next year. And I can assure you that MediTouch and the partner-based products will be 2015 certified this year, well ahead of the deadline. So you're fine there. So the next question is, if you're using FIG, can you choose the categories of quality, or does it just have to be done on the website? Well, when we hook up that FIG interface, what it does is it just pulls everything out of there, and it presents everything up on that website. So you've got a lot of flexibility there, and you'll go to that web page and you'll look at the data and then choose the ones that make the most sense to you. This is a good question. Someone is looking at a specialty measure and it says EHR for submission. How can you tell if the EHR is set up to do the measure? I'm not sure that my answer is the right one. I'm not sure I understand the question. But in the past, and this goes to the practice partner-based EHRs, in the past, the practice partner EHRs were only certified for 64 quality measures. Now, because of FigMD, you can choose any of the 271 measures. So as long as you can really use any of them this time. However, if your question is the EHR set up for it, that we would have to dig into each of those measures. That's what I kind of went back, I alluded to a moment ago about what we would do, is we'd have to look at what the criteria are for that measure, and where that information gets entered into the EHR, and a lot of times, as you probably know from years gone past, we'll create quick text in the templates or clinical elements in the templates that make it easy for you to just click through and enter that information. Okay, well, the questions have kind of slowed down, and we're coming up on the hour here, so I've got a few more minutes. If there's any other questions, please feel free to chat them in. And interestingly, nobody phoned in a question, which is kind of interesting. Well, it seems as if the questions have, that's the end of the questions. So let me again thank you for your time. I hope I was able to shed some light on the MIPS program. My email address is in the slides. My phone number is on the slides. By all means, feel free to reach out to me directly if you have any questions. Thanks again, everybody. I'm going to go ahead and end the webinar now.